Hill with the Rock Island County Health Department. It's 1:30 p.m. on August 25th. Today we have with us Nita Ludwig of the Rock Island County Health Department and Ed Rivers of the Scott County Health Department. In addition, we have Jason Roessler, who is from Rock Island and has recovered from COVID, to tell his story today. One reminder that we would like to pass along is that when media shows this, we ask that you show the translator in a bigger screen so people can get the full benefit of the translator services. We've been seeing that she's been very tiny, and that's hard for our hearing impaired people to understand what she is saying. Let's start off with some numbers. Nita, how about Rock Island County?
Hi, good afternoon. Today in Rock Island County, we have 30 new cases of COVID-19 to report, and that brings our total to date to 2,091 cases of COVID-19. Unfortunately, today we also are reporting 3 more deaths due to COVID-19 in Rock Island County, and that is a woman in her 80s, a woman in her 90s, both of whom were in long-term care facilities, and a man in his 80s who had been hospitalized. Currently in Rock Island County, there are 13 total people hospitalized on the Illinois side of the river, and certainly our thoughts and prayers go to the families of those we've lost to this disease. Thank you.
In Scott County, the number of cases stands at 2,020, and the number of deaths is at 19.
Okay, this is Janet again. We were going to give some basic information from Jason, and I was going to ask a few questions of him, and then if media wants to put any questions in the chat box, I can ask those questions of him also. First of all, Jason, thank you so much for joining us. We really appreciate it.
Yeah, no
Jason
problem.
is 40, you're welcome. He is 41. He is from Rock Island, and he is a welder. The onset of his illness was July 11th, and that is different from what we said earlier. We confirmed that in the disease reporting system. He was able to be off work for 2 weeks. And so, Jason, talk to us a little bit about how you came to get tested.
Well, my wife went to get tested, and I wasn't feeling any symptoms, and her test came back positive. So that day I went and got tested down at the free site down at the QCC Expo Center.
So then, were you feeling ill at that point?
No, I had no symptoms at all. I felt fine. Me and my son went down and got tested at the same time.
And what later happened to you?
Well, I ended up getting a cough. I lost my sense of smell, but I never really had a fever. I never had any other symptoms really. I just had the cough.
So how do you feel now?
I feel great now. I mean, I went back to my normal life. I mean, no symptoms have, really lingered around except for a little bit of a cough. And some days I don't know if that's because I breathe in a bunch of nasty stuff at work or if it's part of the COVID. So
you said that your wife was positive. Is she willing to let you talk about her situation?
Yeah, my wife, she had a cough. She had lost her sense of smell, and she was exhausted all the time when she had her symptoms. Yeah, we had total different cases. I mean, mine was very mild. Hers was, not severe, but it was, in between there. So.
And what about other members of your family?
My dad had it. His symptoms were fairly mild as well. But I also had an uncle that he got it as well, and he was on a ventilator at one point. He is off the ventilator, but he's still not out of the woods yet. I mean, he's currently still in the hospital. So he did have underlying conditions. I'm not sure what those were exactly, but I know he's still in the hospital as of today.
And then there was someone in your family, in your own household, who did not get sick, right?
Yeah, my 12-year-old son, he never got sick at all. I mean, he rode in the same car I did to go get tested. So, I mean, obviously it attacks everybody differently.
What type of lessons did you learn from this experience?
You know, I was a little worried going into it with the COVID-19. I'm a type 2 diabetic, and you know, I tried to be really careful with a lot of stuff, and just it just came into our family, and I'm not real sure how. But when I got it, I was really surprised because I didn't have any symptoms at all, and you know, they were saying that people with underlying conditions could get it pretty bad. So I was pretty nervous about it, but after I got it and realized that it didn't affect me the way that I thought it would, um, I was able to kind of move past it. And I mean, we wear our mask when we go out, but you know, we still live our life.
Okay. We have a few questions from the media. They are asking for your wife and uncle's names.
Yeah, I prefer not to give them out. I just rather not give those out.
Okay. Another question is, do you have any idea how your family came to get infected?
No, I have no idea how they came infected at all.
What did you learn from when you were talking with the contact tracers? Did they, I mean, they can't really talk to you about other people's private information, but did you share any of the contact tracing discussions with your other family members?
No, I didn't. I mean, I was there when my wife was contacted by the contact tracers, and I mean, I'm pretty sure that's how I ended up with it. It's from my wife. So, but I mean, once we knew we had it, we didn't leave the house. We were pretty much quarantined ourselves to the house. So.
Would you say that your family was careful before you got this?
Yeah, I mean, we were fairly careful. We would, only go out when we had to the store, and we would wear a mask when we went out. We always tried to take precautions to make sure we didn't get it. And I mean, we took precautions and still ended up getting it. So.
Okay. How difficult was dealing with the unknown that comes with this disease?
It wasn't really that difficult. I mean, once I got it, it was there, and I was like, all right, well, we'll see what happens. And, nothing really came of it. I did my quarantine and just went back to work. I mean, I felt fine the whole time really I had it. I just had a cough. It just felt like a cold.
Okay. How is your uncle doing now? I know you said that he wasn't out of the woods.
Yeah, I mean, he's still in the hospital. I haven't talked to any of the family in a couple days, so I'm not real sure how he is there. I know they moved him from Trinity in Rock Island to another hospital so that they could give him better care. So.
Okay. So you're saying that the contact tracing process was easy. Can you describe that?
They just called me and asked me questions about, where I had been, who I had been in contact with, um, you know, where I think I may have got it from. But yeah, it was very easy. I think I was on the phone with them for 10 minutes or so. It wasn't a big deal. I was on quarantine anyway, so I was stuck at home.
Okay. Were you worried that you would spread it to your son?
We were worried. We tried to keep him away from us as much as we could, but we're still in the same household, and so he was still here.
Okay. What would you like people in the Quad Cities to know about COVID-19?
I think people worry, which they should. There's people dying every day, from it, but I mean, um, as a person that's had it, I'm not scared that I got it and that I was able to recover. So I feel pretty good about that. I just don't know, the unknown is can I get it again? And that's the biggest unknown, and it seems like nobody really knows that.
Right. A lot of things we don't know because this is a brand new virus. We have one more question at this point. Have you been getting more carry out or fast food as a family?
Not since we recovered. We still go out to dinner. Um, we'll go out, get our meals, and we wear our mask in and out. But no, we still go out to dinner, eat in the restaurants. We're not trying to avoid it. We we live our lives. We're not trying to hide from it, but we do take the precautions that are recommended. Wear the mask and in and out. So that's what we do.
Okay. Is there anything else that you would like to share with folks?
No, I think we've kind of covered everything that I was thinking. And
There's a couple more questions here.
no problem.
Your immediate family, your wife and son, everybody's okay now?
Yeah, my wife recovered. My son never had any symptoms. He never once had any symptoms of it. He was tested. He came back negative. So yeah, and as of today, he still hasn't never showed any symptoms. And we're like, I think 4 or 5 weeks now since I had it and recovered.
Okay. And is he back in school?
He is in school. He goes to Rock Island School, so they're doing the in-home learning.
Okay. Nita, here's a question for you. Can you tell us how many cases are from long-term care centers compared to not long-term care?
Yeah, I don't have those numbers right in front of me at the moment. Those outbreaks that are in long-term care centers are reported by the Illinois Department of Public Health on their website. So I could look that up. That is changing, as people are tested and become positive, those numbers do change. But the outbreaks are all listed on the Illinois Department of Public Health website, and I'll put a link in the chat box for that.
Okay. Well, I'm not seeing any more questions. I want to give a very special thanks to Jason for sharing his story with us. We've been looking to find someone for several months now, and we appreciate your willingness to tell your story, because sometimes people just don't understand this virus when we're reporting just numbers, and you telling your story will help get the message out that COVID is definitely out there, and everyone needs to take it seriously. So if there's no other questions, we will conclude this for today. We do expect to have a briefing on Thursday with a mental health professional talking about the stress of family life, especially now that kids have restarted school. So thank you, everyone. We'll talk to you on Thursday.
Janet, so sorry, but can we talk?
Nita, did you have anything to add?
Yeah, so we still have the community-based testing site for COVID-19 at the Tax Slayer Center parking lot in downtown Moline. So I'd just like to remind people that the testing site for COVID-19 is open through Sunday, this Sunday, August 30th, 9 a.m. to 5 p.m. every single day. And they will test you whether you're symptomatic or not, and it is free for Illinois residents. Thank you.
Right. Thank you, Nita. Thank you, everyone, for joining us. Thanks again, Jason. I will be sending out some notes that I took. They're not as complete as some of the reporters out there taking them, and we do have a photo that we can send along. So thanks again for all of your time, and we'll talk to you on Thursday.